Now it's time to discuss something you're probably waiting for, many of you, PFAS, or polyfluoroalkyl substances. Yeah, the chemical pronunciation is not so easy. Also known as forever chemicals, due to their persistence in the human body and in our environment. With nearly 23,000 hotspots in Europe, and cleanup costs estimated as many billions of euros, this has become a key public health, environmental, and economic issues. Again, do it for the economy. I invite to the stage Professor Tina Kold Jensen, who will discuss the effect of PFAS on children and their overall development. The floor is yours.
Thank you for the kind invitation. I've been here before, now working with Misha and with this group before, and it's always a pleasure to be here to talk about this topic, which is very close to my heart. And I think it's going to be a little bit of repetition because many of these things have already been said. But I think what was really nice and empowering was that I was giving a plenary lecture on Monday at this ESPE and EDCs conference, and it was in the big conference hall, and there were so many people that they had to video it in the next room as well. And it just tells me that people are interested in this topic and it's important. I cannot remember how to do it. I'll just try. Yes. So these chemicals are, as you know, found everywhere. I think one of the issues we haven't discussed so much, and we're going to discuss that with Kenneth, who is coming after me, is the firefighting foam. And also, they are found in pesticides because we use them in pesticides to make sure that they stay longer on the ground, so they don't, so they can the pesticides act longer. Also, rain clothes, and I'm going to come back to that, paint everywhere. And there are these long carbon chains, as you probably know, with fluoroatoms, making them very resistible to grease and stain. And there are more than 8,000 of them, and they bioaccumulate and have a life of up to 5 years. This means that it will take me 5 years before I get rid of half of my exposure if I'm not exposed to anything during the next 5 years. So how do we get rid of these? Well, it's easy because they're transferred to the next generation. So women pass them on to their children, both through the placenta and through breastfeeding. Therefore, the firstborn child is higher exposed than the secondborn. And that's how we do it. They're easily transferred through placenta and breast milk. And as you said, Juliet, it's very expensive. This is the hotspot area. This is very interesting because last time I was talking, there was this map. This is made by many 17 European newsroom shows actually went together and tried to map how PFAS exposure was distributed across Europe. And here you can see all the red dots are places where there is known contamination. There's more than 40,000 sites with known contamination. And when you see Spain and Norway, that there are no red dots, it's not because they're not there, simply because they haven't been measured in these areas, so we don't know. Of these, it was not 20,000, but 2,100 hotspot areas. This is areas in which the human exposure is so high that it's potential hazardous to the health of the population. This is a lot, isn't it? I mean, this is a lot. And when I just talked to Kenneth, as he said, he's going to talk about it after me. In 2020, when you looked up PFAS and health, there would be 6 references. Isn't that true, Kenneth? And now there are many, many thousands, but this is a relatively new chemical. We didn't know anything about it just 5 years ago, or we didn't know much anyway. And now we know a lot. And now the people from Korsør that Ken is going to talk about who are high exposed, but also when we found it in sea foam in Denmark. So it's in sea foam, and then people, all the surfers came to me wanting to have their serum tested. Fortunately, they were not high exposed, but we never know, do you? It's absolutely everywhere. And the EFSA has suggested these effects, and you probably heard about them. I'm mostly going to talk about effects on children and pregnant women, but interestingly, the critical effect is the effect on the vaccination antibodies. So if you have a vaccination, how do you produce antibodies towards that vaccination? And that is reduced if you're exposed to PFAS. And that has been the critical effect by which it has been regulated. And that has not been shown in animal studies because you cannot do studies like that in animals. So in the infant child cohort, we measured PFAS repeatedly. We had over 300,000 biological samples stored. We haven't measured PFAS in 300,000, but in around 3,000 children and women. And now we related PFAS exposure to many different things. And one of the things I found when I said that in the big audience, I could hear this, because this is the PFAS of the mothers and the duration of breastfeeding, and then the PFAS in the children aged, I see whether I can point, 18 months. So the longer you breastfeed, the more you pass on to your children. So children are exposed to high levels of these chemicals if the mothers are exposed to high levels. And here's my study showing that in the infant-child cohort, exposure to these chemicals actually reduces the antibodies towards known childhood vaccinations. That's not only in my study, many studies have shown that, including Grandjean studies, but I think it's so interesting because this is a relatively strong outcome, because you expose all the children to the same antigen at the same time, and then you measure the response to that. So it's almost like a clinical trial, isn't it, compared to what else we do in epidemiology. But it generally affects the system. And here it is. Here is other studies, and there's a meta-analysis. I'm not going to go into details with that, but many studies have found this effect. But does it affect other symptoms of infection or other diseases? And it does. In this child cohort, we measured infections by sending text messages to the women every 2 weeks for a year, asking them whether their children had infections. And we found that when you ask these women for 2 weeks, for every 2 weeks for a year, their children have more days with temperature if they were exposed to these chemicals in utero. So there were more days with temperature in these children, and also there were more days with hospitalizations due to infectious diseases. So these chemicals generally affect the immune system of the children. Also in asthma, I'm not going to go into details with it, but bone mineral density was also measured. We found that it affects the bone mineral density of the children, which is also really, really scary, isn't it? Because the bone mineral density of the children is probably not important, or it is important, but it's the long-term effect. Are they going to have osteoporosis or more fractures in later life? We don't know. And finally, we did the IQ. And IQ was measured by a Wechsler's intelligence scale, which is a standardized IQ test. And we did 4 sub-tests of that. We did it at the children age 7 in their schools. And more than 1,500 children participated. Neuropsychologists came and tested them. They thought it was really funny. They wanted to come back the next week to do it. Now they're 12 and we're trying to redo it, but now they don't think it's funny anymore. They're teenagers. But what we found is here that the higher exposure to PFAS in utero, the lower the IQ. But only 1 or 2 points, as was measured by Simone this morning. It's not a lot, but 1 to 2 points. But if we look at the children's own exposure at age 18 months, they had a higher IQ. So the higher exposed they were to PFAS, the higher IQ. Well, this is great, isn't it? You could just be safe then. But when we tried to separate it from the effect of breastfeeding, that was what's so interesting, because the beneficial effect of breastfeeding actually outruled the hazardous effect of these chemicals in a low exposed population. I cannot tell you how it would be in a high exposed population, but this just tells me that breastfeeding is beneficial to children, even though they're exposed to PFAS. And this slide we showed already, IQ at a population level, 1 IQ is a lot, not for the individual. And I think that's the same with these chemicals. It's probably not a big deal for the individual, but it's a big deal for the society because we're all exposed. So 1 point IQ loss will give us much fewer Einsteins and more children needing help. We talked about this already. All the politicians talk about this, how it worked. I think the ECHA, based on a proposal from Denmark, Norway, Sweden, Holland, and Germany, tried to propose that we completely ban the non-essential use of PFAS. And this, I think, is a very good proposal, but there was more than 5,600 comments, and now they have to go through that to actually figure out what to do with all these comments, and it's going to take a long. So, in conclusion, I think these are forever chemicals. I have just received in an ERC grant, it is called PFAS for everywhere, because it is everywhere and we're all exposed. So these chemicals are forever chemicals. We can find them everywhere. And We can even find them in polar bears. And since they don't use rain clothes or microwave popcorn, we can just tell us that these chemicals are everywhere. And we're all exposed to them. And it's a global problem. I actually talked to people from TINC, and in my big lecture, I gave them just new studies showing that in 13 out of 17 rain clothes jackets bought outside the EU from international websites like Temu and Amazon, they had PFAS. So even though we ban PFAS in the EU, we're not safe because this is all over the world. We have to do something globally. And especially fetuses and young children are very vulnerable due to their, Terje showed you how important it is that hormones act to develop the organs in children and infants. And they're immunotoxic and associated with antibodies and infections, and also probably associated with no psychological development. That's a global problem. I said that again, it's 2 times, it's even more important. And this is my group. And I would like to thank you and look forward to the discussion.